All right, so today I want to talk about the importance of informed consent. Even though this is an elective procedure, even more so, it's extremely important to make sure that you're properly consenting your clients. So I just want to show you a little video of what I go through to consent my clients. So I do have a patient here, our lovely mind coach, Bruno. He has volunteered to be tribute. So when I have my consent screen ready, by this time, there's a good chance I've probably already talked about a lot of these things already, but even still, I'm gonna check them specifically and let them know like, hey, this is what you're signing. And of course, he's gonna get a chance to read it. So the biggest thing to know is, okay, I'm an RN. And so in order for me to perform this procedure, I actually have a nurse practitioner check all the questions, the videos, the photo we did to make sure that you're an appropriate candidate. So this first one here, this says that my doctor and my nurse practitioner can review everything and make sure that, we're good to go. And again, you'll be able to read these in depth if you want. This one says that you'll pay for your services today, which we'll always talk about before you get any service. Okay, so we'll talk more about that. And then this one is optional, the photo video consent. And this says that you're comfortable with allowing me to use your photos and videos for social marketing. Is that something you're comfortable with?
Yes.
Okay, so then we'll check that one. The communication consent here, this is kind of cool. This says I can like text you and let you know if we have any specials or deals going on. Are you okay with that?
Yes.
Okay. And then this one is for the Botox itself. So this one's really important. I do like to, kind of like I was telling you earlier, it'll take 3 days before you see it kick in. It can take 14 to 21 days before you get final results, okay? And like we were talking about, it's not gonna just take away wrinkles, it's gonna stop that muscle from moving so that you can't create that wrinkle anymore. Now, one thing to keep in mind is it's actually normal for your muscles to take the Botox at different time periods. So like one side might take it better, like on day 5, and then this side will catch up on day 7. So if you're like, oh gosh, it's a little uneven, don't freak out about it until, just trust the process. It can take, again, 14 to 21 days. Now, 91% of patients will get headache reduction from Botox, but 9% of patients can get headaches from Botox. So I just always kind of like to let people know, typically if you get headaches afterwards, they're only gonna last for like a week or so, and you can take a normal over-the-counter medication to treat them. And it's not like a debilitating headache from research. And then I want to say it's around 3% of people, they can get fever or flu-like symptoms for 3 to 5 days after Botox. It's kind of similar like when you get a flu shot and you just kind of feel a little crappy. That can happen, but honestly it's very rare. It is rare. And then of course there are other things to keep in mind. Now, I'm skilled at what I do. I study anatomy. I'm very comfortable with that. However, everyone's anatomy is different. And so there always could be something unanticipated that could occur from getting Botox. And so if there's anything that happens, I want you to give me a call so we can talk about it. Okay. You have any questions about any of that?
No.
Okay. So at this point, I'm going to actually have you read through all of that. And then once you're ready, I want you to hit sign and accept, and then you can sign it. Perfect.